This morning we discussed the happy news that the Duke and Duchess of Cambridge are expecting their second child, a brother or sister for Prince George.
Well, like many expectant mothers, however, the Duchess is experiencing a bout of severe morning sickness.
And with that in mind, we're taking your calls on pregnancy health. We're joined by registered nurse Caitlin Dean, who, exactly like Kate, endured extreme vomiting during her pregnancy, and Dr Dawn is here. Also, busy morning for you, Dawn.
You were sick nearly 2,000 times, weren't you?
Through my first 2 pregnancies.
Oh,
yeah.
gosh.
Yeah.
Now, it's interesting because our first caller, I mean, this is given the blanket term morning sickness, and in actual fact, it is so much more serious than that sounds. And that's the point that I think Jennifer wants to make on the phone now. Hello, Jennifer.
Hello.
Hi. So you are saying that that it should not just be put down to morning sickness.
No, this is a terrible condition. I've been suffering with it. I've been in hospital 3 times due to dehydration, and I just think it needs to be brought to light how my pregnancy has become a complete nightmare. I've been so poorly.
Yeah, and Jennifer, you clearly have had quite an extreme case. I think I totally agree with you. The term morning sickness is very misleading. It suggests that actually come noon everything's fine and you feel great. That's not the case. You can feel sick all the time. And for most women when they're pregnant, they get a bit of nausea and that will wear off by about 12 or 14 weeks. For some women, and you are clearly one of them, it is a very significant condition and it's miserable. And yes, you end up in hospital because you get dehydrated, you can't keep your fluids down, and we need to put you on a drip. And I think Kate Middleton was in hospital, wasn't she, with George because of this. So it can be a very serious condition. Important that you do watch your hydration. So your urine should be straw-coloured. If it's getting darker, that's a sign that actually, if you're suffering with morning sickness, I think we should use the term hyperemesis, which I mentioned earlier. Hyper just means excess, emesis is the medical term for vomiting, and that is a much clearer description of what you're describing. But if your urine is getting darker, that's the first sign that actually you are getting dehydrated and you should be seeking medical help.
It's a scary time, isn't it, when you're first pregnant and obviously you're going through those 12 weeks and everything in your body is heightened anyway, you're concerned about everything. Regular morning sickness is completely normal and nothing to be worried about.
Yes, normal pregnancy sickness is a normal part of pregnancy, and in fact a lot of women look forward to it and are quite excited to experience it because it's generally considered to be a sign of a healthy developing pregnancy. But actually not having that distinction between morning sickness and hyperemesis gravidarum is one of the things that actually can in fact add to the suffering of women like Jennifer, who, you know, repeatedly hear on the news, oh, acute morning sickness, morning sickness, morning sickness, and that's not what she's got. And that actually can have a really detrimental effect on her emotional well-being while she's suffering, because it adds to the isolation that she'll be feeling. You know, she's housebound with this, and she'll have people saying, oh, you've just got a bit of morning sickness, you just need to get on with it.
Yeah, not the case.
But that's not the case. It's actually a really serious condition.
Well, Jennifer goes on to say
it's
difficult, it's stolen any chance of future pregnancies for you.
Yeah, I mean, I tried well over a year to get pregnant with this child, and I will never, ever put myself in this situation again, which is very upsetting for me.
Yeah, I bet.
Well, and that just shows how miserable you feel, actually.
Yeah, and that's very common. You're not alone in that, Jennifer. There's a lot of women who have the same experience, and on our charity website, Pregnancy Sickness Support, on the forum, you can actually get in touch with other women who are in the same situation.
Can I ask a question? I know that the Duchess of Cambridge obviously has had this with both pregnancies now. What's the likelihood of you, if you've had this as serious as this once with the first pregnancy, were you guaranteed to have it every time you get pregnant?
It's about 80%.
About 80%.
And every pregnancy is different. One of the things we first think about when we hear of people really struggling with vomiting is this a twin pregnancy or a multiple pregnancy, because it's more common in twin pregnancies. But every pregnancy is different, every woman is different, and every woman's experience of each pregnancy is different.
And certainly with normal morning sickness, that's very much the case, that you can have it with one pregnancy and not the next. But with hyperemesis gravidarum, it's about 80% will have it again.
And no idea what causes it?
It's down to the hormonal changes, and it's a woman's individual sensitivity to those hormonal changes. And because you've got higher hormone levels with twin pregnancies, you get it more often.
Jennifer, we wish you lots of love and wish you well, OK?
Thank you for calling, Jennifer.
We wish you lots of love. Good luck with the baby.
Thank you very much indeed. Thank you for pointing it out, and also...
yes, of course.
Jennifer, you can get support through the charity. You can be matched with a volunteer who can give you peer support for the rest of your pregnancy.
And hopefully the joy of that baby will, when it finally arrives, will help a little bit of what she's had to go through.
OK, we've got another caller on the line now. We've got Kirsty. Hello, Kirsty.
Hi.
Good morning. Now, you're 21 weeks pregnant, aren't you, with your second baby? And you're having a problem with itchy skin, itchy legs?
Yeah, I mean, it started off not as bad, and then it just got worse and worse and worse, and it's like to the point of you're scratching your legs so much it's starting to bleed, and you don't want that.
Ah,
no. OK. Itchy skin in pregnancy is actually quite common, Kirsty, more common towards the latter stages of pregnancy, and it can sometimes be linked to liver, so your GP may want to do a liver blood test. But it's important that you keep your skin really well hydrated, so make sure that you're using a lot of moisturiser. It is actually safe to take antihistamines, and you may find that what happens when you start scratching, you damage the skin, and that produces histamine to come into the skin, and that makes it more itchy. So you get a temporary relief from the scratch, and then you get a rebound worse itch. And if you use antihistamines, which are safe in pregnancy, make sure that you tell the pharmacist when you're getting them that you are pregnant. They'll make sure that they give you something safe, and then you can break that scratch itch cycle, because you don't want bleeding legs.
no, that sounds absolutely horrible. I hope that helps.
Thanks, Kirsty. Thank you very much.
Thank you.
Thank you. You're welcome.
Thank you.
Kaylee. Hello, Kaylee. Is Kaylee on the phone?
Yes.
Hiya, Kaylee.
Good morning.
Hiya.
Hiya, what's your problem?
I had my baby 6 weeks ago. He's my second one. But recently, my hair's been falling out like it did with my first son. But this time, it's coming out loads, and I've got loads of bald patches all over my head. I'm just wondering what's the best thing I can do to stop it, basically.
Hayley, this is almost certainly nothing to worry about. I can't tell you how often I see women with newborn babies who are terrified that they're going to lose all their hair. What happens is we lose about 100 hairs from our head every day. That's the hair that you find on your clothes and your hairbrush and so on. When you get pregnant, the hormonal changes mean that those hairs stop falling out. And it's one of the reasons why we often say people blossom and bloom in pregnancy. They get a lovely shiny head of hair. Soon after the baby's born, and 6 weeks is a little early, it's usually nearer 3 months, 6 months, all the hairs that you would have lost during that pregnancy start to fall out at once. So I see women all the time who say, no, you don't understand. Honestly, I really am going to go bald. In fact, that will all settle down. Because it's happened that little bit earlier in you, I think it is worth going to see your GP, because things like having a low iron level can sometimes mean that you get more hair loss, and it's quite common to be low in iron during a pregnancy. So your GP may want to do a couple of blood tests, check your iron level, check your thyroid, but it almost certainly will all come back normal and your hair will be absolutely fine.
Anything you would like to add there?
Just that I also had a lot of hair loss, and
It's
it is quite shocking, you know, in the shower, plugging the drain up, but it is normal, and it does grow back, and unless it's becoming very excessive, in which case see your GP.
OK.
Thank you very much indeed.
We've got a question here. This is from Katie. She said, my baby is due today, but no signs yet, and the mega moon didn't help out last night, Holly. Sorry about that. She says, what's the best way to bring on labour, if there is such a thing, or is it just a waiting game, Katie?
I think it's just a waiting game. There's lots of fun things you can try, like eating curry and having lots of sex. But it's largely old wives' tales.
What about, like, reflexology and things like that? Aren't there supposed to be points you can press on your feet that make you go into labour?
It feels nice, but it's expensive, and, you know...
And the point is, you know, some people are then going to go into labour naturally. There is some science behind sex, because there are natural prostaglandins in semen. So, you know, whether or not they're enough to really make a difference, but there is some science behind that one.
So there you go, sex it is. If the moon didn't work, try that.
Brigitte says, I'm 25 weeks pregnant. I have a high dependency pregnancy because I have a large cyst and gestational diabetes. I've been having the Braxton Hicks for the last 10 days. Wow. Is it normal for them to last this long? I've spoken to my health care professionals, and each one has given me different information. I'm left confused. I need peace of mind.
OK. Braxton Hicks are the practice contractions, and they can be really quite uncomfortable, but they're not regular, and they don't become more and more frequent like the contractions of labour. It's important that we know that the baby is moving normally, so it's important that she makes a note of baby's movements and so on. Practice contractions are normal, they're nothing to worry about, but if they are becoming regular or very painful, it is important that she goes and gets that checked out.
Yes. And 10 weeks in your experience?
Yeah, no, in my third pregnancy, I was having strong Braxton Hicks from about 24 weeks or something. It's really quite...
I was going to say the same thing. I've had Braxton Hicks for a long time.
Yeah,
I quite like it. It makes me feel like everything's working.
Yeah, yeah.
As long as it doesn't get painful, which I guess is that when you then need to get it checked.
And so you can reassure her there?
Absolutely. You know, as long as these aren't regular and crescendoing like the labour pains that you would get, then this is just practice contractions. It's your uterus or her uterus getting ready for the job in hand in a few weeks' time.
It's all working.
Just going back to where we started here with Jenny, because she said, I'm 24 years old, 17 weeks pregnant, first child. I've been in hospital 3 times due to severe dehydration because of that hyperemesis. And she says, how can you control it? Are there techniques that you can recommend? It doesn't sound as if there are.
There are things that you can help with nausea. Hyperemesis, you know, when you're really vomiting and you're sick, you need medical help. But for somebody who is feeling nauseous and vomiting occasionally, as is normal, if you like, morning sickness, eating small amounts regularly, carbohydrates, so a biscuit, a piece of toast, something like that. Taking rest. It is worse when you're tired, undoubtedly. Ginger. A lot of people say that they find ginger helps.
Ginger's very unpleasant to throw up.
Oh, really?
Oh, really?
But it has, you know, ginger tea or a ginger nut biscuit. Sometimes people find is quite helpful.
Yeah.
But you know that you can't, if you've got proper hyperemesis, you need medical help. You know, chances are you will need a drip and you'll need medication to settle the vomiting.
All right.
Yeah, I mean, that's our message, is that it's important to get early treatment to stop it from becoming really, you know, having severe complications. You know, the ginger thing is something that a lot of hyperemesis women will be screaming at the TV, going, no, not ginger,
because if you've got
for mild nausea.
Sickness,
but unfortunately, it's something that women, you know, who have got hyperemesis are constantly told, have you tried ginger? And they're sort of there on their drip going, if only ginger would help, you know. And actually, it kind of undermines their experience. The isolation and loneliness for women with HG is a really profound part of the condition, and that's why, you know, getting help through the charity, connecting with other women who are going through the same experience and can really understand what they're going through is really important, and getting that early treatment.
Okay.
Thank you.
Thank you
all very much.